Ludwig Guttmann is known as one of the most prolific influences on the modern Paralympics, particularly due to his work with spinal cord injury victims in 1948. This presentation will outline the ways in which Ludwig Guttmann directly affected those with disability in relation to sport in a positive way. Firstly, it will look at his use of sport and recreation as a means for rehabilitation. Secondly, the creation of the early Paralympic Games. And lastly, how his efforts have changed people's view on disability. In 1948, Ludwig Guttmann introduced sport as a component of rehabilitation for his patients in Great Britain who had obtained spinal cord injuries, SCI, during World War II. Guttmann believed sport facilitated physical, psychological and social rehabilitation and aimed to provide his patients with a recreational outlet to accompany generic rehabilitation practices. Post-World War I, Britain had an 80% mortality rate for those soldiers who had become paraplegic. Guttmann began his work at the Stoke Mandeville Hospital in 1943, where he explained sport's therapeutic value as a complement to traditional physiotherapy. Guttmann used sport to counteract the attitudes that were generally associated with disability. It is believed that disabled persons' attitude towards themselves deteriorates into an inferiority complex characterized by anxiety, loss of self-confidence, and personal dignity that results in self-pity and self-isolation. Guttmann's aim was to change the attitudes of his patients. He did this through instilling self-discipline, self-respect, competitive spirit, and comradeship. Once his patients displayed these traits, Guttmann felt they would be prepared to reintegrate into the community. In the years that followed, the use of sport remained a key tool in rehabilitation of SCI patients. In 1964, equal opportunities to compete in adapted sports were also given to those with visual impairments, amputees, paraplegics, and those with cerebral palsy. Narrow and Shepherd discussed the goal of SCI rehabilitation has since moved from an extension of life expectancy to the patient demonstrating independent living and a greater quality of life. Whilst the goal of SCI rehabilitation has changed slightly over time, Narrow and Shepherd agreed that sport can increase one's physical mobility, reduce physical dependence, and encourage social integration, all outcomes which stem from Guttmann's beliefs. The word paraplegic is derived from the Greek word para, which means alongside, and the word Olympic. This means that the Paralympics existed side by side with the Olympics. In 1944, Guttmann opened a spinal cord injury centre in Great Britain where he used recreational, followed by competitive sport, to rehabilitate his patients. In 1948, he organised for 16 injured servicemen and women to participate in the Stoke Mandeville Games. The Stoke Mandeville Games became internationally recognised in 1952 when ex-servicemen from the Netherlands joined this movement. Rome was host to the first Paralympics in 1960, where 400 athletes competed from 23 different countries. Just as the Olympics do, the Paralympic Games have since taken place every 4 years. What was first known as the Stoke Mandeville Games has since grown into a worldwide sporting event that is inclusive of all disabilities. The Paralympic Games have played a major role in working towards equality between those with and without disability. These international games have forced some countries to acknowledge the presence of disability despite the fact that they had previously hid or even denied disability existed. Guttmann dreamed that one day there would be an international sporting event for people living with disability, and this event may bring everyone together. As the Games have progressed and become a focal point for disability worldwide, there has been a push by many nations to improve disability legislations. For instance, prior to the 2004 Games in Athens, the Olympic Board sought to ensure access for those with disability in all aspects of the Games. Efforts were made to make the arenas, dining outlets and public transport all accessible to the population group. Companies that complied were acknowledged and made known to those requiring such facilities. More recently, specific cities that had already made these concerted efforts in society found themselves eligible to host the Paralympic Games, as they had the facilities to do so. Atlanta, Sydney and London are a few examples. Whilst people's view towards disability has positively changed over time, this population group are yet to be deemed equal. Paralympic Games continue to struggle with sponsorship, which leads us to question the true support of this international event. In 2012, the Australian Paralympic runner Evan O'Hanlon led a silent protest with fellow athletes which saw them taping over the major sporting logos on their attire, as these brands would not agree to sponsorship. The Paralympians were forced to provide their own personal uniforms. In an interview with Guttmann's daughter, she stated that there were still a few areas of the Paralympic movement that needed work. Le Fleur believed that the media coverage of the Paralympic Games is not equal among all nations due to a lack of understanding of the emotional nature of watching some of the Paralympians. Her main concern, though, was that there still remains countries who compete in the Olympic Games but not in the Paralympic Games.
created using Powtoon.